Hi, this is Dr. Tasman Cordie. I have a functional medicine practice in Little Silver, New Jersey. And Lyme disease is caused by a bacterial infection. It's an interesting bacteria because it sometimes acts like a bacteria, it sometimes kind of acts like a virus, and it sometimes kind of acts like a parasite. But officially, it's known as a bacteria, and it typically comes from a tick bite, from a deer tick. It used to be thought that it was mostly in the northeastern part of the United States. But now we're finding it in every state of the United States. And so it's not something that's localized to just the Northeast. First of all, it's not localized because of the ticks only being here, because they're spreading, because the climate is getting a bit warmer, and even those few degrees warmer, a little bit warmer winters is allowing them to move farther and allowing them to not die during the winter time. But also people travel a lot. So people in the Northeast move to Colorado, and people in the Northeast move to California. And so we're seeing it everywhere now. It's not just a disease in the Northeast. And it's caused by a tick bite. If it's handled very quickly with antibiotics, usually doxycycline, a lot of times that will handle most of the infection and clean it out of the system. In an effective enough way that we don't have a chronic Lyme condition, which is very real for a lot of people who don't identify and handle it with the doxy. Or it's very real for some people who do that and still get chronic Lyme anyway. And Lyme disease is characterized by a red rash, a bullseye rash that surrounds the tick bite itself. People sometimes see that and sometimes don't see that. More often they don't see it. Or don't realize they've been bitten by that deer tick, and so they don't even see the rash. Deer ticks are very, very small. And then after that bite, they start getting lots of deep aches in their joints. That's the first thing that most people will talk about, and they'll show up in their doctor's office and say, oh, I'm really, really achy. I feel like I'm getting a flu or a cold or a fever or something like that, or some kind of an infection. And then once we do some better testing, or just put them on a round of doxycycline to see if that handles it, and it does, it probably was a Lyme disease infection. And that's, in its very simplest terms, what Lyme disease is. It can be hugely complicated and absolutely devastating for patients who get chronic Lyme and aren't able to handle it fully, or even in part, and it can kill you. Because it can result in all kinds of secondary infections and co-infections, all kinds of secondary conditions and diseases as a result of tissue breakdown, as a result of autoimmunity that develops because of how those infections affect the system. But very simply, Lyme disease is a bite by a tick. You get a bacterial infection, usually causes that red round rash, and it usually causes achy joints and some kind of flu-like symptoms initially. And often when it's handled quickly with typically a round of doxycycline from your med doctor, we can usually handle it pretty well.